waking up in the night more than once is troublesome. It disturbs the quality of life. Waking up in the night can be a problem in the aging. This can be because of the prostate in the men or overactivity of the bladder in the men as well as women. And the treatment is often the use of medications for prostate or medications for the overactive bladder. But in this population of patients who have to wake up multiple times in the night to pass urine, there is a subset of population which does not improve with the prostate medications or with the overactive bladder medications, and they do not improve because they have a very different cause for their troubles. In fact, waking up of the patient multiple times in the night is a protective mechanism by their body. Typically, these patients will tell us that they have to go 2 or 3 times or maybe 4 or 5 times in the daytime, but they have to go multiple times in the night. So they will have a problem of only waking up in the night and passing urine at regular intervals. They will not have any frequency in the daytime. All such patients obviously need to see a urologist. They need to be worked up with certain blood tests and an ultrasound and a urine examination, and if required even a heart checkup to rule out any major disease. So why this happens? This happens because the muscles of the legs, because of aging, become weak. So these patients will typically have a history that when they wake up in the night, they pass good quantity of urine, and then for the next 4 to 5 hours they do not pass any urine. Then after midday, around 12 o'clock or 1 o'clock, they start passing urine every 2 to 3 hours. And this continues till they go to bed. Once they lie down in the night to go to bed, then they keep on passing urine every 1 to 2 hours, and they have to wake up multiple times in the night. So they will have no increased frequency in the daytime, but they will have significant frequency in the night. What happens is, when they wake up in the morning, suddenly the blood which was in the body starts getting pulled into the legs. So effective volume of the blood which was earlier 5 liters, it experiences a sudden loss of blood volume. Some of the blood volume, let's say around 500 or 750 ml of blood, starts getting pulled into the legs, and because of the weakness of the muscles and because of the gravity, this blood does not go back to the heart. So when it does not go back to the heart now functions at a blood volume of only around 4.25 to 4.5 liters. And the heart sends a message to the kidney, don't produce any urine. So the patient does not produce any urine for the next 4 to 5 hours and keeps on conserving all the water he is drinking. Now once he has conserved the water, the blood volume effectively comes back again to 5 liters. And the patient is very comfortable. Now when he lies down, what happens is that this blood which was pooled in the legs now suddenly comes back to the heart. So heart in the morning was at 5 liters, then it became 4.25 liters, then it became at 5 liters, and now the heart suddenly has to function at 5.5 or 5.75 liters of blood. So the heart again sends a message to the kidney, so the kidney starts producing a lot of urine. If the kidney produces a lot of urine, so you will wake up multiple times to pass urine. If we give any medications, the patient does not improve. Why? Because there is nothing wrong. The whole increased frequency in the night is because of increased production. No medication, whether we give the medications for prostate or we give medications for the overactive bladder, nothing is going to work. So for such a group of patients, what we need to do is actually do some lifestyle changes. So what are the lifestyle changes which we need to do? First and foremost, we tell such patients that do not drink much liquid after 4 p.m. Usually decreasing the fluid intake after 4 p.m. however is not of much help. What helps such a group of patients? If we keep our legs hanging in the daytime, then the pooling will happen. Whereas if we keep our legs while sitting on a stool or something and keep it upright, then this problem will not happen. Secondly, they should lie down in the afternoon for at least half an hour to 45 minutes. When they lie down in the afternoon, this blood which was in the legs starts going back to the heart, so they have lesser of blood volume which is pooled into the legs. To help this blood to go back from the legs to the heart, what they can do is that they can keep a support under the heels, which keeps the legs elevated. However, we have to make sure that the support is only under the heels. It is not placed under the calves. If we place something under the calves, then the calf muscles actually get blocked under that support and the blood flow decreases. So it will be counterproductive. We will not have any benefit of lying down. So one is lying down and second is place something under the heels. However, some patients may not improve after this also. This is the group of patients where we will have to then tell them to wear elastic stockings. The moment you wake up in the morning, first thing you have to do is wear these elastic stockings. Once these elastic stockings are worn, it will strengthen the muscles of the legs. So there will be no pooling of the blood in the legs and the blood flow will keep on happening back to the heart. Thus, there will be no extra fluid available to the kidneys in the night and thus no increased urine production and thus no increased frequency. So what needs to be done for such patients is, first is restrict fluid intake after 4 p.m. Second is lie down in the afternoon, preferably with the support under the heels. And finally, if nothing works, wear elastic stockings the moment you wake up in the morning. Thanks a lot. Hope you liked the video. Kindly subscribe and share.